Hello, good day. This is Dr. Trudy, and today we'll talk about safe medication use during pregnancy. So today we'll be discussing about safe medication use in pregnancy. This is a very important topic we need to pay very close attention to. The reason is because in pregnancy, we have to do everything necessary and everything possible to make sure the mother and the baby are given a better chance during birth. So today we'll talk about the use of medications during pregnancy, things you need to know, and things you need to avoid. It's well known that most pregnant women know it's wise to avoid taking medications unnecessarily during pregnancy. And if you're currently taking medications, it's possible you're on prescription medications or you take over the counter medications. Many women take medications for a variety of reasons, of which there are a couple of health conditions that might warrant you to be taking medications on long-term basis. People that have morning sickness, which is one of the commoner signs you're pregnant, might likely be on medications. People that have high blood pressure, people that have diabetes, and a couple of other conditions might likely be on medications. All of these medications I mentioned are all safe to be taken during pregnancy because if it's not properly controlled during pregnancy, it can worsen. Other women might take medications just routinely without knowing they are pregnant. So this is actually where you need to pay very close attention to. So be very mindful, and understandably, there can be often this uneasiness when you feel you might be carrying a precious baby in you and you're taking medications without knowing your condition. So is there any drug that is safe to use during pregnancy? So do we have any particular medication that is actually safe to use during pregnancy? We'll talk about that. So let's just say less is more during pregnancy. Just have that mantra at the back of your mind. Less, it's always more. In life, more, it's not always more. In things relating to medications, less is always more. So the less medications you take, the more you have a better chance, even without the pregnancy state. Because for any medication you take in your body, a couple of them have adverse effects, so you have to be careful. So in pregnancy, always have it at the back of your mind that less is more. If you can actually avoid taking any medications and get up to 39 weeks and take only your prenatal multivitamins, which is the only medication you are supposed to take, then that would be ideal. But in real life, we have to deal with ideal situation and reality. Reality is so many people can come down with cold symptoms, so many people can come down with aches and pains here and there, or even morning sickness or constipation. So everything I've just mentioned are common during pregnancy. So what can you do to provide relief when you have any of this? I always recommend doing non-medication intervention first. So for example, if you have morning sickness, before you go about town telling your doctor to give you prescriptions, think about some non-medication interventions you can do. You can try eating crackers. You can eat smaller, frequent, and less fatty meals. So the issue we've discovered that the more fatty the food is, the more the likelihood you're going to have morning sickness. So eat crackers, eat smaller, frequent, less fatty meals. It's been shown to be very helpful to women that have severe morning sickness. Also remember that if your symptoms persist for any complaint, if you've applied that home remedy, which most times I advise people to just stay off medications, like if you have cold, increase your fluid intake, make sure you cover yourself properly, take your flu shot if you're within a flu area. If you've done all these and you still have the symptoms, please reach out to your healthcare provider immediately. So it's very, very important. Clearly, not all medications are safe in pregnancy. We know that. Even headaches and pain medications may not be safe during certain stages of pregnancy. So the trick is to always ask questions and talk frequently and openly with all your healthcare providers Remember, your healthcare providers are not just the doctors. The pharmacist can help you in this regard. The nurses, some of them can prescribe. So please talk with them openly when you're dispensing your medications. Feel free to ask them. They know much better what you need to do. Whatever happens, please make sure you ask all your health providers. So you're under the care of all these people I mentioned. So staying safe is a partnership between the doctors, between the nurses, and between the pharmacists. The idea is to make sure you arrive at the ultimate goal, which is having your baby in good condition and you also being in good condition. So I'm going to give an example like in the US, currently, we have an association a body that actually regulates medications and drugs, Food and Drug Administration. So they actually categorize medications into different classes. So we have category A, B, C, D, and X. So the use of these categories is to help you know the safety level of any medications you're taking. So for all medications, they label it either A, B, C, D, then X. So the same criteria is used in some other countries. So if you're not in the US, wherever your location is, try and be well informed on different classifications of medications. You might be familiar with what we have in the States. The 5 categories are useful to help you visualize the fact that there is no hard and fast rule in safety when it comes to medications. So generally, the idea is to choose drugs and medications within category A and B. They are generally safe. And the other option is to avoid drugs that are in category C and D. Then to completely avoid any drug that has an X. You do not want to take any medication that has an X because it's been shown to cause harm to your unborn baby. So please learn to always read labels. Check expiring dates on all medications before you take them. Buy all your medications from reputable pharmacies. Pay particular attention to the contents. Educate yourself on what you should be avoiding while you're taking this. Remembering that less is always more, generally, especially in pregnancy. So, are there some medications that are actually safe in pregnancy? The answer is yes. There are a couple of medications over time we discovered that the use of them in pregnancy is actually safe. Some medications are used frequently during pregnancy and they appear not to cause major birth defects or other problems. Some antibiotics like penicillin, some painkillers, some fever reducers like acetaminophen, which is popularly called paracetamol, and ibuprofen. Remember, ibuprofen is a medication. If you have a need for pain, I will generally recommend you use acetaminophen, which is paracetamol. But if you are to use ibuprofen, remember to avoid it completely in the last 3 months of pregnancy. So the last trimester, you should not take ibuprofen for any reason whatsoever. Also for constipation, we discovered that Docusate is actually good for constipation. What also calcium carbonate is used for heartburn. So constipation and heartburns are also commoner in pregnancy. So these are a few safe medications you can take while you're pregnant. Of course, there are many more other medications out there that are actually safe, but you have to make sure you run it by your doctor, who will generally have a safe drug list to choose while prescribing medications for you. Many OBGYN practices will have a very safe drug standard protocol before they prescribe for you. So if you're on prescription medications or supplements, or prior to now, you're taking some medications, some supplements, some herbs, please make sure you discuss that with your doctor. Very, very, very important. Do not hide any of your drug medication history from your doctor. Make sure your doctor knows everything, disclose it to your provider. Everything you place in your mouth, everything you inhale or rub or spray on you can impact the pregnancy in so many ways. So the earlier you notify your provider, the better. On a side note, never lean on the word natural. So some people feel that once you have natural, it's safe. There are a couple of things that are natural that can harm you and harm your baby when you're pregnant. So be very mindful when you hear the word natural, it doesn't necessarily mean safe. Let me use an example. Green tea is generally considered natural and full of antioxidants. Antioxidants are substances that help to fight oxidants. Oxidants are very harmful to the body. But guess what? During pregnancy, we discover that when you take green tea, it depletes the body of folic acid. Folic acid is a substance that is very important in normal development of a structure in your baby's brain called the neural tubes. So green tea depletes the folic acid. So green tea naturally is, natural generally, but the fact is natural doesn't mean it's encouraged when you're pregnant. So do everything within your reach to be careful because something like folic acid, when your baby is lacking folic acid, the baby can develop neural tube diseases, which you don't want to have. So also remember that some herbs generally are medications, but run it by your provider before you take any herbs. Okay, so in summary, remember in pregnancy, more it's not more, less it's more. If you can avoid taking any medications, please do. If you have to take any medications, run it by your doctor. Avoid taking medications without consulting your doctor. Avoid self-diagnosis. Please don't walk to the pharmacy and buy over-the-counter medications. If prescription drugs use it's warranted, always consult with your doctor. Remember, every woman is unique. Every pregnancy is unique. Although we can make some generalizations, but how you react to some medications might be entirely different from how the other person reacts to medications. So to close, remember in pregnancy, less is more. So if you can avoid, please avoid. I hope to see you on the other side of joy when you have your baby and you're in good health. Thanks for listening and do have a good day. Bye bye.